So it was one of those great Saturday mornings. You know the type when you get to sleep in and have a nice relaxing day. A young man rolls out of bed to get that second cup of coffee. And as he's coming back into the bedroom, his wife is standing in the door of the bathroom and says, "Hon, come on in, I want to show you something." So he walks in the bathroom, and there on the counter of the sink is a positive pregnancy strip. They both yell and scream, they hug each other, they jump back into bed, and they begin to talk about all the sort of things that you would talk about when you're expecting a baby. It's going to be a boy or a girl? Do we need to quit our jobs? Do we need a bigger house? When do we tell our parents? Boy, this is scary. How are we going to be able to afford a baby? How are we going to find childcare? All the sort of things that a young couple would talk about. So on Monday morning, as it rolled around, they were able to call the OB's office and make an appointment for later that week. Both took the day off, went in to see the obstetrician, and did the sort of things that you would typically do in a doctor's office. Filled out the forms, sat in the waiting room. They were brought back. Of course, again, just verifying some information, did, height and weight and blood pressure, took some lab tests, and also did a first ultrasound. So as the staff person was sitting there talking to the young couple, getting all that information, validating information, asking them certain questions, all of a sudden she became very, very quiet and very noticeable to the young couple, and made them both very, very nervous. And they sat there in silence as the young woman said to them, "The doctor will be in to see you in a few minutes." So definitely a change in tone. A few minutes went by, it seemed like hours to the young couple, and finally the OB-GYN came in, and after some pleasantries and congratulating the young couple, talking about this great part in their life, great moment in their life, began to talk a little bit about their practice, and then again, very quietly grabbed the stool, pulled it up, and she looked at them in the eyes and said, "I'm very, very concerned about your baby. I'm very concerned about your baby's diagnosis." And the young couple looked at the doctor and thought, "Diagnosis? This is our first visit. What do you mean diagnosis?" And she said, "Well, your baby is a 43604. And the young woman said, 43604, 43604, that's our zip code. And the physician looked them in the eyes and said, "Exactly." And what we found in our country is that the 5 most important numbers in your life many times is your zip code. The zip code of where you were born, who your parents were, how you lived your life, the social and economic conditions of your life, and that alone, that and genetics, has more to do about your health and well-being than anything we do in healthcare, any clinical thing we can do. And again, as we've seen the events unfold over the last few months, one of the things that people now hear about are these social economic factors, something we call the social determinants of health. In the United States, if you go to our major cities and rural areas across the country, you can see a 10, a 20, a 30-year difference, 30-year difference in life expectancy in the United States. So how in the heck does that happen? How can you literally be blocks, a quarter of a mile away from each other and have a life expectancy difference of 20 plus years? And why haven't we talked more about it? Why has that not been an issue? And a lot of these issues, it's just been our indifference to these issues. It's not that we haven't known about them. It's not that parts of our society have worked to address these. We've just never integrated them into the way that we take care of people in our lives. So right now we have a large industry, large healthcare industry, that really is on a path. They've been on a path since the 1930s, almost 100 years path. And if you look at how they've consumed resources in this country, the amount of dollars spent on healthcare just continues to climb. And probably the last dozen presidents have all said the same thing. We have a major problem in our country in healthcare spending is out of control. We said that when it was 5% of the GDP. We said it when it was 10% of the GDP. And now in just a short period of time, it'll be 20% of our gross domestic product and there's really nothing we can do about it. It's demographic driven, it's trend driven, and yet we spend $6 trillion on healthcare, and you really have to ask yourself, is that really the right thing to do given how we think about healthcare today? And you've seen these statistics along the way. When we begin to look at what we get for the $6 trillion, it's one thing to say, oh man, it's like going to the Four Seasons. It's the best, everything is taken care of. But yet we have this huge difference in life expectancy, costs, which are a critical issue in our country. The number one cause of personal bankruptcy is related to healthcare costs. Seniors, 85-year-olds filing bankruptcy at an all-time high. Why? Because of healthcare costs. We have more preventable deaths. We have high instances of hospital-acquired infections, deaths from medical errors. And so you begin to look at all these issues and you say, well, truly, is this really how we should spend our $6 trillion? And this graph is the countries we typically compare ourselves to. And the lighter boxes point out that you're actually worse than the other countries. And as you see, the United States is very lower. So we have 30 million people that are uninsured in this country, 30 million people. And yet when you begin to look at the financial impact on them and what we're getting for our dollars, you have to really ask yourselves about the model. So 1 in 3 people say they can't access healthcare because of cost. 1 in 3 people say the biggest worry of their lives is healthcare costs. 1 in 10 Americans in a Gallup poll in the last few months reported that they knew someone who died prematurely because they couldn't afford healthcare. So as we think about our healthcare system and we want to celebrate our healthcare system, we really have to be concerned that we really have the right model. So one of the things that we have seen in the last couple of weeks unfold with COVID and how COVID has impacted certain racial and ethnic minorities at a much, much higher rate. And all of a sudden, we're talking about social and economic conditions and what many people would call the social determinants of health. The WHO defines social determinants of health as really those things that kind of go back to your zip code, where you grew up, who your parents were, what kind of home you lived in, what kind of resources, what kind of opportunities you have. That is more important to your health and well-being than anything we do clinically in healthcare settings. And as you look at the chart here, 20% of healthcare, 20% of your health and well-being is related to healthcare. And the other things are far more important in your overall health and well-being, and it kind of makes sense. You don't hang around hospitals every day. If you think about your health and well-being, you don't run to a hospital, but it's those things that are critically important. So about a decade ago, I worked for a healthcare organization, and we thought we would address obesity. And a lot of health systems around this country do what they call community needs assessments, and it was part of the Affordable Care Act. It is something that we have most health systems have done for a long, long time, even before the Affordable Care Act. And we looked at kind of what came out of it, and we said, well, obesity is a problem. Let's invest some dollars in obesity. So we created these great learning maps. We hired trainers, and we created maps for different sort of ages and for their parents. And we put them into the schools and the summer clubs and the Ys and all those sort of things. So this goes on for a while. We felt pretty good about ourselves. And after 4 or 5 months, the trainers asked for a meeting. And they weren't happy. And they said, this isn't working. And we said, okay, what do you mean it's not working? These kids are hungry. And our response was, no, we didn't sign up for hunger. We signed up to teach them to eat healthy. And they go, they can't eat healthy because they can't afford good food. And their obesity is linked to the food. And what we found out is that food is a major healthcare issue in our country. Pretty basic. Healthy moms, healthy babies. We just want to make it a welfare issue in our country. And so we have this issue that food is medicine. Hunger is a health issue. 13% of households are food insecure, 19% of their children. 33% of single moms and children are food insecure. That means they miss 100 meals a month. And the meals they do have aren't all that good. And yet, we spend $6 trillion on all the stuff in healthcare, and we have people in our communities all over our nation that are struggling with food insecurity. And what this led us to do is we've now screened for food insecurity for over 10 years. We've done 3 to 4 million screens. We provide short-term food needs, baskets of food, make food available. We have food pharmacies where doctors can write scripts. And individuals can sit down with a counselor, a dietitian, and really plan out meals that they can afford that are nutritious, and especially if they have some medical conditions. We started an inner city grocery store in a food desert because no grocery store, no grocery chain would help us. We've done farms, mobile meals, and really this idea is how can we take care of someone clinically and yet not look to all these social issues in life? And so what we've done over the last decade is now we've begun to screen for the 10 social determinants of health and go back again. We can spend all this time and effort taking care of someone clinically, but wouldn't it make sense to you that when you went into a doctor's office, they asked you, do you have access to good food? Can you really take care of yourself from a nutrition standpoint? Do you have the economics to take care of yourself? Do you live in a safe home? Do you have money to afford the procedures I'm going to ask you to do and the prescriptions I'm going to give to you? Behavioral health. Do you have utilities on? Do you have transportation? Do you have employment? All those things are critically important, but yet we look at a person physically, and yet we never look at these social determinants of health. And if you think about how healthcare has evolved in our country, it's really not made all that much sense. And the problem that we have is that for all the right reasons, we built hospitals across America. And today we have some, major beautiful hospitals. One of those is an organization I work for. You have to have glass on your big buildings today. And really we have a hospital-centric model. And it's been that way since World War II when, because of the Hill-Burton Act, we built 7,000 facilities and 4,000 communities. And guess what? We still think of hospitals as a central part of your health. And my guess is you do not. I do not. And really, when we think about care and the type of kind of care that we want to deliver in the future, it's really much more consumer-based. It's much more holistic. It has to take into account the social determinants of health and other things, including life purpose. And really, what we need to do is move away from this hospital-centric model. What COVID has taught us is that hospitals are critically important, absolutely. We do not need more hospital beds in this country, by the way. What we need to do is invest in those services outside of hospitals. And we have a broken healthcare system. We need to fix it, and now is the time to fix it. What we do have, though, are the best caregivers in the world, no doubt about it. But we've asked them to work in a model that really doesn't work. So really, it's time for a new model, and it starts with reallocating our spending. We are spending a lot of money. We have this massive healthcare industry, pharmaceutical companies, hospitals, insurance companies, medical device manufacturers. We're spending tremendous amounts of money, and it's a major issue, it's a major industry, it's a major political force, and either we all need to spend more money in order to address these other things, tax us more, or we really need to reallocate healthcare spending. Hard thing to think about, hard thing to do, very, very political. We need a national focus on the social determinants of health. When we look at the impact of COVID and why COVID has impacted certain minorities and not others, it's because of those social conditions. It's because of their social and economic health, and we don't have any focus. We should mandate tomorrow that every healthcare facility screens for the 10 social determinants of health. And oh, by the way, we are now screening employees. We screen our employees with the idea that if you screen employees, you can interact in their lives, higher retention, higher recruitment, lower healthcare costs, higher productivity, doing those things for your employees for all the right reasons as well. We need to invest in senior care. Kind of a travesty what's happening right now in senior care in this country. Everyone is throwing shots at senior care, governors, media, lawyers, and really, what do we expect? It's a bit of hypocrisy to complain about senior care when we reimburse senior care less than we do a budget hotel. And for that, we're expected to provide great clinical care with the best staff, beautiful facilities, 3 meals a day, And all these opportunities to, be involved in activities and mental stimulation, it just doesn't work. It's a highly, heavily regulated industry, and yet we think we care about seniors, but we don't. And it's this whole idea in our country that we don't value our seniors. And again, one more time, as we think about investing and where our investment should be, senior care is one. And of course, we've seen our problems in public health. Huge problem in public health in our country. As healthcare costs went up 50%, public health investments went down 25%. And over the last decade, a reduction in about 25% of their staffing. And what we've seen is we don't have an integrated public health system. We're not prepared. It's not linked. We don't have the right data, and we don't have the right stockpiles. It needs to change rapidly. So how do we do that? So for the last several years, we've been in Washington lobbying for a National Commission on Health. Why a National Commission on Health? Because nothing's going to change otherwise. The model is going to continue. We're going to go from 19% to 20% to 25% of our GDP. We have a long history of national commissions. We've had over 125 national commissions, some of them very, very successful. And the charge to a national commission would be this. This is a model that can't continue. We need to invest in these other issues. So either we need to increase taxes, or we need to find a new model, and we need to move money from some of the things that we've invested in historically and move them to some of those other areas. And we need to do that over a period of time, a decade, maybe 2 decades, but at least we would have a new model. So the question for all of us, is this zip code going to be the most important numbers in people's lives? Sitting here today, a pessimist would say, oh, absolutely, this too will pass and nothing will change. An optimist would say, no, now is the time. This is about America's priorities. This is about America's collective will. And a lot of things, what we've learned over the last few weeks and months, it's about our character. It's about the choices we made. And I think if you step back and think about it, if there was ever a time we address these issues, now is the time. Thank you very much.